Number 1. Patients must be the center of the health system. The healthcare system exists primarily for the benefit of patients, but their voices are so rarely heard. Every policy, budget measure and proposal must be considered through the patient lens. That does not mean the impacts on providers, hospitals, clinicians and health insurers should not be considered. They are also stakeholders and usually the decision makers. But the government's first instinct has been to consult with privileged groups such as the Australian Medical Association and private health insurers, rather than with the public, patients and providers at the coalface. Importantly, viewing health reform through a patient lens will help policymakers identify. Number 2. Invest in health promotion, not just illness treatment. Prevention is as much a responsibility of government as it is for individuals. This is particularly the case for obesity. As a nation, we all bear the substantial and growing economic and social costs of obesity and its consequences, especially diabetes. Every day, 12 Australians have an amputation related to diabetes at a cost of $875 million a year. Almost all of this is preventable. The investments made in prevention must be proportional to the burden of disease in terms of resources and commitment. Concerns about sensible budget policies must over. Number 3. Make healthcare reforms sustainable. This means ceasing the start-stop approach of small-scale pilot programs that never go beyond 3 years and are evaluated only after they are concluded in reports that never see the light of day. Real reforms will also require time frames well beyond those of the election cycle. Labour has proposed a promising way forward. A permanent Australian Healthcare Reform Commission, which would include a new Centre for Medicare and Healthcare System Innovation to embed continuous reform into the healthcare system. This type of approach, where models can be seamlessly developed, implemented, assessed, adjusted and expanded, is essential for reforms such as the government's proposed healthcare homes trial to better manage chronic disease. Number 4. Apply a whole-of-government approach to health. The health and well-being of the population depend on issues well beyond the health portfolio and require a health in all policy approach in all government portfolios. This is a matter of leadership and cultural change, not new expenditures and regulations. Wicked issues such as obesity, mental health, healthy aging and closing the gap on Indigenous disadvantage can only be effectively addressed. Number 5. Data is key. Research, data analyses and evaluation are key to healthcare reforms. The antipathy of the previous government to evidence-based policy making was exemplified by the scrapping or downgrading of key agencies and the defunding of the primary healthcare research, evaluation and development (PHCRED) strategy and the better evaluation and care of health (GEACH) study. These losses must be rectified, but it is also time for the Department of Health to start mining the archives. There are mountains of reports, papers and evaluations, together with significant, policy-relevant primary healthcare research commissioned by the department through the Australian Primary Healthcare Research Institute, to be used in improving the delivery and financing of healthcare services. At the same time, there should be a moratorium on shunting off difficult problems to committees as an excuse for inaction. There will be occasions when it is necessary to convene advisory groups. That should be done using the experts who will provide the advice that is needed, not the usual hacks who provide.